Welcome to what?
To what?
To music.
Music.
That's right. Hello, hello, and welcome to music. Hello, hello to
you.
and welcome to
Music.
welcome to
Music.
music. And I think that music, especially with Pablo, does have a way that transcends the physical limitations that his body has. He really gets beyond the fact that he is a sick child, and he's just Pablo, and Pablo loves music. What can you do with the instruments? Let's hear you play. What can you do with the instruments? You play 'em in your own way.
Music therapy is an art, but it's also a science. Its effects are being documented in research across the country, around the world. Music therapy, when used in hospitals, helps people cope with illness. There are actually many, many symptoms that are ameliorated through music and the facilitation of a music therapist. In cancer patients, the symptoms of nausea, often associated with chemotherapy, have been reduced when people use specific music therapy techniques to focus their attention on the music rather than what's going on in their own bodies. Music therapy can help decrease anxiety, which then affects blood pressure, affects heart rate, and can help prepare the person psychologically and also physically for surgery.
Music affects us so deeply. Music therapy, I think, tunes us in with a whole different range of experiences. A music therapist working with a patient in that relationship is able to model the universal striving for elevating the human experience that one finds in music making and in music appreciation. When we suffer, we need to be cared for. Very frequently there isn't time to attend to the side of the equation which addresses our humanity. And I think that this is where music therapy comes in.
Well, I perceive music therapy as another form of integrative therapy that helps support patients, cancer patients, patients with chronic disease, as well as people who are just dealing with everyday stress and strain. It's alongside of conventional therapy. They're being used together. For example, using music therapy alongside of chemotherapy for a child with acute lymphocytic leukemia. It helps the child, it helps the staff, it helps the family. It reduces discomfort. There's good evidence to show that these integrative therapies, these complementary, these supportive therapies are reducing symptomatology.
I think music therapy is a wonderful discipline.
Listen to the sounds.
After hundreds of years of realizing what kind of an effect music had on human emotion and even on human physicality, we've started to say, how can we take music and customize it to have a specific effect to deal with a specific person's set of problems? And I think that's so very exciting. It allows the music therapist to do something I can't do, that is to address individually the needs of the people that are in their care.
I believe in music. I believe in you and me.
Nice. Thank you for that. I appreciate that a lot.